Good morning, good afternoon, everyone. We apologize for the slight technical difficulties. Thank you so much for joining us. This is Diana Rivera with the Networks of Opportunity for Child Wellbeing team. Our illustrious host here, Rhonda Alexander, is trying to dial back in, and we'll get started very shortly. We appreciate the time you're taking to join us today. We're going to have a fantastic conversation, and really looking forward to diving into a critical topic, community engagement and leadership. So I think Rhonda looks like she's back on, and so I'll pass it over to her.
I think I'm back. Good afternoon, everyone. I'm so sorry for the technical difficulties. Everything was great, and then it stopped. But happy Thursday, and thank you again for joining us as we jump in with some wonderful members of the Now Learning community and our partner network to talk a little bit more about community engagement and leadership, specifically centering around parents and families. So I'll be very brief today as we jump through just a few things to remember. I guess everything changed and I ended up being muted instead of you all, but you all are muted. If you have any questions or ideas or concerns that you'd like to bring up, please feel free to use the chat box. And you can also submit questions through the questions feature on your dashboard, which is likely to on your right-hand side. And we'll be taking those questions as we move throughout the webinar, and we'll make sure to hold them for our Q&A session just a little bit later. So I'm going to share very briefly about the Vital Village Network, and then we'll hear from both of our speakers. So we'll hear about strategies for engagement from Andrea Serrano with Reaching Our Sisters Everywhere, better known as ROSE. And then we'll hear about communities building power for health justice from Javier Morales from the Praxis project, and then we'll spend some time in Q&A. So excited to have you all here. As you all know, the Vital Village Network is a community and a network of folks who are really committed to maximizing child, family, and community well-being. We started here in the Boston area, focusing on 3 neighborhoods back in 2010, and we really focus on service learning and leadership, trauma-informed lens, or using a trauma-informed lens to align systems, and thinking about iterative improvement and data sharing. So these are all of the things that we focus on here in Boston, which helped inform the development and the formation of the Networks of Opportunity for Child Wellbeing and the Now Innovation Forum. And so through the Networks of Opportunity for Child Wellbeing, we work with 10 community coalitions all over the country, and helping them to build their capacity and knowledge and skills to continue to engage a broad and diverse group of stakeholders, to use data to share their stories in a variety of ways, and to engage policy stakeholders. So we're excited to have them here, and we do all of that and share all of this amazing information through the Now Innovation Forum, which you can find online. Here's a quick screenshot to show you how to get to it. So without any further ado, I'm so excited to introduce both of our speakers today. So first, we'll hear from Andrea Serrano. Again, she's a program director with Reaching Our Sisters Everywhere with ROSE, and then also we'll hear from Javier Morales. So I'm just going to give us just a moment to switch over so that we can see Andrea and move forward. So give me just a moment to make sure that we are sharing the right things. All right, so Andrea, I'm going to turn it over to you. Thank you so much, and we'll talk to everyone soon.
Thank you so much, Rhonda, for that great introduction. I appreciate it, and I appreciate you all for having me on the call today. So as what was mentioned, I will be talking about strategies for engagement. Next slide. Our organization is really focused on addressing breastfeeding inequities for communities of color. So we do this through doing trainings, education, and advocacy. And if you would like to know more about the organization, you could read the mission statement a little bit later. They'll be sharing the slides with you. Next slide. This is our team and some of our board members with Reaching Our Sisters Everywhere. We are based here in the Metro Atlanta area, but we are a national organization. So, next slide. And now we're ready to dive into the meat and potatoes of the conversation. And so, reaching our sisters everywhere, when we conduct our community engagement work, most of our work is centered around community engagement or informed by the community. We utilize a model called the CRASH model. Next slide. The CRASH model comes to us from Morehouse School of Medicine, and this is their breakdown of how you engage with communities and partners in a culturally sensitive manner. And so, in packaging your work, whatever that form of community engagement is for you, you want to consider the cultures of the community you're working with, the essence of respect, knowing that if the community you're working with, the partners you're working with do not feel respected, it doesn't help to build a trusting collaborative or connection with each other. And then to assess, you assess the needs of the community by asking the community or your partners the things that they need to be done, what they feel must be addressed. You do your own assessments on also identifying the problems or projects, and also affirming. Affirmations is a key component to what we do. And it is essentially ensuring that those that we are working with, especially when we're doing community work, is knowing that they are heard, that we are affirming that we hear them, we hear whatever their issues that they are trying to raise, or whatever the feelings that they are having, that is highly affirmed. Our director often quotes Maya Angelou by saying, "No one cares what you know until they know that you care." Sensitivity is the next component of the CRASH model, along with humility. None of us are perfect, and even in our best attempts, that there are chances where, if there's a misstep, that is recognized and an apology is made, but just approaching these matters with a sense of humility. Next slide, please. And so, I don't know who all is familiar with this. Usually this is a call and response slide that I give, but I usually ask who knows what this car is called. And usually, depending on your interest in cars and year you were born, you would be able to know that this is the Chevy Nova. And so when the Nova was created, it was, marketed during the muscle cars era of time. And when looking towards the Latino community as a market to also market this vehicle, there's some things that are noted that they didn't see as high as a sale. So Rhonda, if you could hit enter. So if you are familiar with Spanish and you hear Nova, Nova means not going, doesn't move. And if that is what is translated from the vehicle, I don't know too many people that would want to buy or purchase a vehicle that says or means doesn't go, right? And so when we're talking about cultural competency and how we are connecting and strategizing to meet with our community, a key aspect to keep in mind around this is, what is the advertisement, what is the engagement looking like to the community? Have we considered ensuring that they are at the decision-making table to help ensure that our outreach methods, or any of the work that we are trying to do to help build trust is coming from a space that the community can accept or the partners we are working with can accept. Next slide, please. And so a part of our layered work that we do within our organization is centered around empowering a growing cadre of community advocates. So with Rose, our center of addressing breastfeeding inequities within a community is done through training women and families from within the community on how to provide basic level breastfeeding support. The notion and idea is that we know breastfeeding resources is of limited access in our communities, and our goal is to ensure that it is accessible. But a part of being a community transformer, there's a few other things that they do. Next slide, please. So in order to address the work that we do around maternal and infant health practices is that we engage those from within the community. So one of the first things that the community transformers do in the training is tell us also what's going on within the community. And our community transformers training we have done in about 9 states over the past couple of years, have trained over 300 or so women. And even though we're providing information, the power and knowledge in a room is also essential to us as trainers as we listen to the issues or barriers that are being faced locally to that particular community, along with things that are being done to also kind of circumvent some of those issues. So we listen to those things, and that helps draw us to, be more strategic in our work. Next slide, please. And so when we think about the work that Community Transformer does after we complete the training, this includes doing one-to-one peer breastfeeding support, along with leading gatherings within their community, so informal breastfeeding clubs, and also participating in community engagement activities. Next slide. And outside of the direct work we do around training those from within the community to serve within the community, we work collaboratively to do events like community baby showers, which serve as an opportunity for local resources to come together, host the baby shower for expecting families, and provide stuff that you would get at a baby shower, and also play baby shower games. But it's also connecting everyone to the resources. And so when you're working within the community, and for example with our community transformer model, the ladies that we have trained to provide breastfeeding support are talking to their sisters, their friends, people from within their community to invite them to these events. And it also lets us know, when to host these kind of events. We listen and hear, okay, maybe perhaps trying to host a community baby shower on a Monday from 10 to 2 isn't going to be conducive to our community schedule. So we take those type of things into consideration on choosing date and time, along with accessibility to where the venue is taking place. So, our location that we use for our office is really at the heart of the community. We have a wonderful free parking lot right in front of a bus stop, right next to the nearest highway. And so regardless of modes of transportation, members of our community can come and participate. And that's also something we take into consideration when we are collaborating with other organizations, is taking those types of things into context when we are hosting events that are centered around the community. Next slide, please. And so with our strategies with engagement, we are full across the spectrum. And so the 3 ladies that are pictured near the table all attend 3 of local colleges around here in the Metro Atlanta area. One is, all of them have graduated now, but at the time they were interning with us, one as a Spelman student, another one as an Emory student, and another young lady as a Mercer Masters of Public Health student. So 2 were graduate students and 1 undergrad. And this opportunity to, when they entered with us, to kind of educate them on the importance of breastfeeding, helping them to identify what are the myths around breastfeeding, then allow them to kind of help when we do events like this, where they can talk to families and at least provide some basic information, but they themselves also learning and informing their peers and doing projects within their own coursework around breastfeeding, right? And so our strategies, we see it as a very much so multi-systems approach. in our work, and very intentional of how we collaborate and connect the different elements together. Next slide, please. Another aspect of our work is reaching our brothers everywhere. That is our men engagement centered focus work. And with this, it is the understanding that, men are caregivers too, and hold multiple roles within the family circle, whether this is grandfather, father, uncle, little brother, that entire aspect. And one of the reasons why this effort went forth is because on many occasions, when we're doing our community transformer trainings, or, doing engagement out just in general, or serving families here at our baby cafe, we would hear, the fellas say, well, what about reaching our brothers everywhere? What's the, men component in this? And that, as we listened and, had further conversations in Form Road, and then did more intentional conversations with men, we learned that some of the barriers, thank you, Diana, some of the barriers being faced is that in these spaces, men weren't feeling welcomed, or that they felt excluded or disrespected. And so in this work, we did a lot to center men also in our approaches. Next slide. An example of this was we did a health fair, and at that time they asked us where we would like to have our table at the health fair. And I asked, please put me in front of the barbershop as an opportunity to engage with the men who were all getting their haircuts. I don't know the barbershop schedule. I don't particularly get lineups or fades, but on the weekend, it is definitely, I've learned, a very high participation rate at the barbershop. And so having a table set up, next slide, next slide again, that looked like this, where there was a lot of great visuals, along with a basket of chocolate that definitely attracted a lot of people. But it meant that as they came up to the table for some chocolate, they had to hear about breastfeeding information. And although they may not take every item from the table, they definitely took pictures, had great conversations, and was really allowing us to give the opportunity of raising awareness of what resource was available to them and their families. Next slide. And so this is where I say that stock photos sometimes aren't as friendly as we like to think, in that in a lot of the photos that we've used, it really has helped to make the material look relatable to the communities that we're serving. And so the approach is based off of sometimes just a visual. Next slide. Go back, there we go. So take, for example, the Massachusetts Breastfeeding Coalition had reached out to us about feedback around their material on eating on the go, breastfeed anytime, anywhere. And I remember having this particular image up at a health fair table, and someone approached me saying, okay, what food do you have? And at first I was lost. And I said, excuse me? And he said, well, I see eating on the go. Do you have food here? And I was like, well, we're talking about, the first food, and had a great conversation based off of that. But the imagery is what helped pull him in. So I think I probably have 1 minute left, or maybe 60 seconds. So go ahead and skip over to like 2 more slides. Go some more. And go some more. 1 more. Here we go. Go back. All right, so I'll kind of finish up with this particular slide. For the past couple of years, Rose has partnered with Healthy Start New Orleans, and Healthy Start New Orleans participates in Essence Festival each year. Essence Festival is a huge event that happens in New Orleans and brings thousands and thousands of people in, and also from within the New Orleans area. And so at the venue that's used, the convention center doesn't have changing tables within the bathroom. And so what Healthy Start did was they set up a nursing nook where families could come and get breastfeedings, can pump, change their baby on the changing table, and also sit and rest. And although we were trying to discuss breastfeeding and, talk to everyone about breastfeeding, the first meeting point for them was us talking about the changing table being available, meeting the needs of the community first, the interest first, and then being able to, while they were there, discuss more in depthly around breastfeeding. And so these are examples of ways that we strategize to be intentional and efficient with our networking and work within the community, and also ensuring that we are listening to the needs in order for us to be able to address and support the community in the best way possible, while also providing additional resources. And so I'll close there.
Andrea, thank you so much for sharing. I know we're going to get a ton of questions. So at this point, I want to turn it over to Javier Morales, who's the Executive Director of the Praxis Project. So Javier will spend the next 10 to 12 minutes sharing a little bit more about his work and helping communities build power for health justice. So Javier, welcome.
Thank you, Diana. Also, thank you to the Network of Opportunity for Wellness or Wellbeing Now Network, and also thank you to Vital Village, Rhonda, Diana, Dr. Renee, and Andrea for co-presenting with me. My presentation is going to be a little bit more, not as granular, especially in the beginning when I work on the framing. Can we go to my first slide, please? We don't need to go to the title slide. Let's go to the slide that says Praxis Project Goals. And just so you all know, the next slide, please. Just so you all know, just kind of a framing piece, Praxis, who we are is we're a national organization, and we have about 200 organizing groups, base building organizers in our network, and about 100 of them that we interact with on a regular basis, and they work across the determinants of health. We have almost an equal number of Latino, African American, API, and Native American, Indigenous folks, urban and rural. And so it's a pretty vibrant network, and I feel honored that I'm able to work with them. So what we do is we create space for grassroots organizers to share strategies and help build their capacity that way. We also work with national public health professionals to create space for community-led health equity initiatives. And we also try to make the case for philanthropy to directly fund organizing, base building organizing, especially as a strategy to improve the nation's health. Next slide. And what we know is that if you take a look, you go to the Center for Disease and Control and Prevention website, and basically the CDC is like the national arbiter on public health for the country. And you go there and you see they have this list, and it's a very proud list that they have of all of the public health successes from the last century. And you'll see their immunizations, healthier mothers and babies, motor vehicle safety. You guys can read them all as well as I can say them. But the interesting thing, and something I don't have for this presentation because it's a 10-minute presentation, is when you actually drill down and go into every single one of these points, you find that communities of color and communities that live in areas without a lot of opportunity and a lot of disinvestment, you find that we are not achieving or receiving the same results. And so, can we go to the next slide, please? This is a campaign that was done by the California Endowment in California, and basically what it says is that your zip code determines your life expectancy. And so the zip code on the left there for the child on the left born today is 73 years. That's a child that's born in the area of Stockton without a lot of opportunity. Whereas the child born on the right-hand side, born today, has a life expectancy of 88. And that child, that's Newport Beach. And we experience the same thing where I'm sitting right now. I'm sitting in the Fruitvale district of Oakland. And right here in the flats, life expectancy around the folks where I live, or where my office is 72, but we just drive 2 miles, not even 2 miles, a mile and a half to the east and get up into the Oakland Hills, and life expectancy jumps to 88. Next slide. And this isn't unique to California. It's not unique to the Bay Area. This is a life expectancy gradient for our nation's capital. And you'll see that, the wider areas, that's the blue line, especially towards the bottom, and the orange line to the left, and the red line to the top. Those are primarily areas with a lot of opportunity, and honestly, not a lot of people of color, or lesser rate of people of color. But you'll see that the center of the district, the life expectancy is 77 years, and you see 83, 84, and 84 as we go to the left and to the south. But to the east there, it's 78 years. It only goes up one year. And what we know from DC and also Prince George's County is that that's primarily folks of color, especially African American folks. So we see this gradient. And so next slide, please. And so what we do is we scoured research. There's been a lot written on what are those determining factors that they're present, robustly present in an area that will help people to live a longer and healthier life. And so, we didn't make this list up. This list is compiled between World Health Organization, Center for Disease Control and Prevention, Robert Wood Johnson Foundation, the Canadian Ministry of Environment, and some others that have continued to do this research on the determinants of health. And basically what this says is that the more robustly present all of these are in a particular geography, the longer and healthier someone will live. And so this list right here serves a number of purposes. One purpose is, what do we need to be working towards? The next purpose is who's actually working on these things. And what we find is that, it's not traditional health people as we think about traditional health. Now, what we're finding out is those community gardeners that are working to help teach kids how to produce food and to actually make food available in food deserts, they're promoting health. Folks that are out there, advocating for parks, they're promoting health. Immigration climate, where there's less stress, those folks are promoting health. A fair justice system, those folks are promoting health. And we don't have race or gender or other identity listed out separately within our list, because we feel that those factors actually are the reason that's used, or they're the discrimination is based on those things, and that's what causes these factors to be unevenly present in an area. Next slide. The other understanding that we have is that different communities need different supports, and not just supports to help them endure what's happening today, but like different supports to actually change what's causing them to get sick in the first place or to live shorter lives. So, this is just a frame that I think many of us have seen in different forms. To the far left, we have equality. Every person gets the same supports. And, this one size fit all doesn't really fit all, doesn't help us all. Or, we go to the equity one, and, I really appreciate that the field is moving towards equity. But when we look at it purely from just the supports side, we may not be addressing the root causes of what's causing people to get sick in the first place. So I really appreciate this newer version that comes up, and we start talking about justice, where you actually start to transform the systems that are causing the inequities. So it's not just about helping people to be resilient in the face of inequity, but to actually help them to use their power to change the structures that are causing them to get sick. So this is the frame, a very strong frame we have. And I have a couple of examples that I'll talk through real quick here. Next slide, please. So I got a call from a national partner, and they're a really good partner. And they said, Javier, we know that your network is primarily folks of color. And we know that in communities of color, and rates of heart disease and stroke are really high. Can you help us to get Kentucky Fried Chicken to stop using trans fats? Because we believe that if they stop using trans fats, that we're actually going to be able to reduce the heart disease and stroke rate in your communities, with your constituency. Next slide, please. For me, as I started to talk to my folks, what we really recognize is that, yes, trans fats are not good for us, but neither is stress, neither is oppression, neither is sexism, racism. And so for us, as I talk to folks, they're like, well, if you want to really address what's causing heart disease and stroke in my community, let's talk about food security. Let's talk about economic security, housing security. And again, you know, it just makes sense. We're going towards that far right end of that graphic that talks about the justice, where we're trying to get in and actually change those conditions so that people will be not be getting as sick at those high rates as before. Can we go to the next slide, please? I'm going to give you another example. And I loved Andrea's conversation, or when she talked about the listening piece, when the robe, I forget what the actually stood for, but it was basically the men in the community saying, hey, what about us? We have a role in this too. And they were able to develop a component of their program that actually addressed the needs of the men in the community as well. And that's something that's super important, because if we come in thinking we have the answers and we haven't consulted with the community, we may not have the best answer. So I'm going to just digress just for a couple minutes here on a soda tax that we passed in Berkeley in 2014. So, you know, there was a previous strategy, I call it the public health perfect. This was devised by some national folks that did the research, and they figured out if we really want to reduce soda consumption, what we need to do is put in a 2-cent per ounce tax. It's got to be a dedicated tax. We got to say where the money's going to go. It's got to be a retail tax, because we want folks that are buying soda to feel the pain at the register. And so their whole approach was focused on raising the price so that poor people basically couldn't afford it. They were literally just adopting the tobacco model and putting it onto this. Whereas, you know, they tried this strategy 30 different times and it failed every single time. And they were set to still continue to keep doing this. They thought that the market would move towards them, society would move towards them. But in Berkeley, in 2014, we came together and we're like, you know what? We had a cooking and gardening program in our schools that was going to be defunded. We were losing the funding for it. And they're like, we need funding for this. And so they said, you know, but we know that public health perfect will not work here. We instead are proposing to do a 1 cent per ounce tax. We're going to do a general fund tax. We're going to tax the distributor. We're going to tax the producer, the distributor. And we're going to have folks from the community at the table to help us decide how to invest those funds back into the community. And basically this newer approach, and this is a much longer story, I'm really truncating it here, but this story really adjusted to what the community needed and the community context and community priorities. And that tax passed. That was the first one that we tried in the nation. Can you go to the next slide, please? And so the argument here that I make is that, and Andrea made partly, is that, you know, we really need to listen to the community. We really need to make sure that our interventions work with the community. I found that a lot of times we have some national campaigns that are looking for a place to implement their programs. And it's more about harnessing the power that already exists in community to advance these national campaigns. Whereas this other approach where you actually come in and you develop something in partnership, that's how you know you're actually addressing the community's needs. If I were to go back to that Kentucky Fried Chicken and the people slide, you don't have to do it, don't move back, please. But if I went back to that slide, the implication there is that we have some national public health folks that are doing good work, but it's like they've moved beyond our communities. In their world, the priorities, you know, they're not having to deal with economic justice, food justice. They've moved beyond survival, whereas many of our communities are still in that survival space. And that survival space is what's really driving the health inequities. And so we, also the thing is, by working with community and listening and co-producing with them, we actually come up with interventions that are needed and that people buy into and will actually move forward. Next slide. So, you know, this is just a compilation of different groups that we've been working with across the country, you know, on community gardening, on gentrification, anti-gentrification, on defending water resources, trying to advocate for health, universal health care, trying to advocate for, you know, minimum wage, that a living wage. And the thing to remember here is that we have the professionals that are out there that do this work, but then we also have community folks that do this work, and we need both. We need both. I think that oftentimes our professional mainstream partners, when they think of solutions, they don't really think of community, but until the time comes when you need people to get bused to a Capitol or bused to City Hall or to come to a community meeting, council meeting, that's when they think about folks. But really, we need to be working together early on to make sure that the interventions we're looking for actually align. Next slide. So I really like that crash model that Andrea presented earlier. But here's, when I talk about authentic engagement, it really is about building trust with the community, having the community know that you're there to support them in their priorities on what they're trying to achieve. And we have to build trust, and we have to build capacity or lead capacity. We don't always have to be the leader. So my short list here is, when we do authentic community engagement, show up. You got to show up. You got to show up when it's not just about you. You got to show up when it's about what they're trying to do. You build trust. You earn trust that way. And I've had some really interesting discussion with some folks that were talking about they recognize that they got to come in with humility, and they can't come in and try to be the leader. So they talk about leading from the side. And that to me is even not really understanding the capacity and the power that exists within a community. And sometimes, we just got to get to the back, and we just got to push. We lead by pushing, and maybe it's not even leading. Maybe we're just helping to help folks that are leading at the community level to advance what they're doing, and we do it in whichever way they need us to show up and help them. Co-producing, co is the operative term here. Everything that we do with community should be co-designed, co-produced, co-implemented, co-proposed. The financials should actually be shared. Actually, it'd be great if the community was the one that subcontracted to the professionals, but that they were the place that got the grants. We got to share capacity. If we need to do a community survey, instead of just coming out and just convincing folks why this survey is good for them, why don't we work with them to help them understand the thought process behind the survey so that they can actually learn how to do surveys with us or themselves. And after our project is done, then they will be able to do their own surveys moving forward. And the next piece is just recognizing the inherent power. I really don't like using the word empower, because that really sells short the community, because the power is already there. And sometimes life gets in the way. There's so many things that folks have to deal with. It's hard for them to focus that power. And sometimes our role is to just come in and maybe help them to focus that power, but it's really to recognize the inherent power that exists. Next slide. And so, with that, I kind of feel like I came in at the 100,000-foot level. Andrea's presentation was spot on at the local level. I mean, and those examples. And I hope between the two of us, I didn't come off too 100,000-footy, and that it actually helps you guys with some of the work that you guys are doing. And to reach me, it's just my first name, Xavier, Javier, at thepraxisproject.org. I should have it on this slide. I apologize. But with that, I'll just stop there. And again, thank you, Andrea, for allowing me to share your stage. And thank you, Diana and Renee and Dr. Rhonda and Dr. Renee for letting me participate.
Oh, well, thank you so much, Javier and Andrea. I mean, you all just said so much that was so good. And the thing that I heard resounding was about the power that exists in the community and being user-centered. And if we are aiming to serve our communities, then we need to be focused on them. So I cannot wait. I have a few questions that have come up for me, but I already see we have a question that's popped up in our question box. And I'm just going to advance the slide for just a moment to remind you of how to submit your questions. There's a dashboard over on the right-hand side of your screen, and what I'm going to ask you to do. So feel free to post your questions there, and then I'll ask our panelists to try and answer questions as within a minute or so, maybe two, so that we can get in as many questions as possible. But the question that we have that comes into us from Christine Wiebe from Washington, she says, what are some of the most common barriers to building trust that are also some of the most complex to address? So I'll leave that to either one of you to jump right in and take a stab at.
I think some of the most common barriers and that are at the same time complex to address is whatever may have previously happened that has caused distrust and pain, right? And this so often comes in, the shape of, someone, organization, institution, whatsoever gets funding to go do such and such research, go into the community, say this, do a lot of prodding and poking and sometimes maybe, just focus on addressing their research and then pull out once they got what they need and are gone, and whatever resources that they had temporarily brought are gone with them. And so it creates that rebuilding of, okay, folks are only just coming in to use us as guinea pigs and not actually try to collaborate with us. And it becomes a reoccurring pain because a lot of the language that you sometimes see is, doing work in low income communities of color as, the proposal piece that people need to apply for. And quite often, like Javier had mentioned, is that the individuals at the table who are writing these grants, submitting the grants, aren't necessarily directly connected with the community that they're writing the grant about, right? So the workaround in addressing that with is the first phase. We can't go 0 to 100 with it, but recognizing the space and need for healing, because that needs to occur, number one. And sometimes when you start that healing conversation and building that relationship, this might become before there's any type of funding opportunity for it. But when you are working intentional and you do that piece first, then when a funding opportunity does arise, that relationship's already there and the work can be co-created.
Yes. And I don't need to repeat everything you just said because you're spot on. I would just recommend that folks do a search on this book called My Grandmother's Hands. And it really talks about some of the trauma that exists in communities and in individuals, actually. And this trauma that causes us to fight, to flee, or to withdraw. And it's really about a generational trauma that has been built up that we have to unlearn. And so it's a very fast read, and by reading that, I think it will give more insight into why and how people respond to each other, given a legacy of there's plenty of reasons why there should be distrust, and there is distrust. And this is a book that can help to start to get us in the direction. I don't have any stock in the company, by the way, just FYI. There's no conflict in making that recommendation.
No, well, that's great. It's funny. I think, and I'm thinking, hopefully I'm pronouncing the name of the author right. Is it Resmaa? Looks like she's from Minnesota, which is where one of our coalitions is based, and she's developing an online curriculum. So we were just able to find the link, so we'll make sure to share that in the chat box. Oh, excuse me, I apologize. So I actually had a question for both of you around something I heard both of you talk about around building community power. How might you activate this, and how might you share this, and what are some more examples of what it looks like to build upon the inherent power that's already within a community?
I'll jump in. Most places are not vacuums. I mean, most places there's probably already some groups that exist. And so, going in, and it might be like a PTA. It might not be the PTA. Some PTAs don't reflect the population of the kids that go there. So it's being real intentional and going in when you're trying to find those allies. It could be a church group. But I think the first step is to go in and to see what folks are already doing. And it may not be directly aligned with your initial interest or why you're needing to seek out a group, but it's a group that already has built that infrastructure and built that trust. Because unless you live in a community, it's almost I'm going to use a real strong word here. It's almost irresponsible to, it's not that strong. It's irresponsible to come in and try to develop those direct relations with community members if you're not going to be there over the long term. It's always best to work with a group that is going to be there, because they can check you, because maybe the great idea that we have, and we have money to help push forward, maybe there's a reason why that's not a good thing to be doing in this moment in this community. And by working with these groups that are already there, that can serve as like a filter or a guide for us. I'll stop there.
And, just to add on to what was wonderfully said already is, I take, for example, some of our trainings and works that we do, that empowerment is not even empowerment, but just recognizing the power that's already there is through our marketing and our work. Are you interested in supporting your community, with breastfeeding support? And when we come to the training and it's time to train the ladies, we let them all know, you all have come into this room with your own toolbox. You all are already doing phenomenal work. All this training is doing is just adding to your toolbox, right? We're not coming in trying to say that here we are, the bestower of knowledge to help you, those who do not know. No, it's recognizing that that power is already there. And, all we're doing is helping to add to the power you have already. And so when you come from the lens that there is power in a room, regardless, that is a strong perspective in helping to see now where we as different puzzle pieces can come together and connect for the larger picture.
Yeah, you just got an amen and a totally agree from Melos Loso in Minnesota. She says that's exactly how I frame my advocacy trainings in the community too. So I love this. And it actually leads to another question that I have. And again, I want to encourage our participants, feel free to continue to share your questions with us. Another question that comes to mind, I think, as you all talked about partners and working with folks who are in the community and thinking about non-traditional partners. I think, when I was doing work in schools around building great culture in schools, they would only invite educators and administrators. I'm like, what about your custodial staff? What about your lunchroom staff? Those are folks who are working with students, so those non-traditional partners. And so I'd love to hear a little bit more about some examples you all have around engaging non-traditional partners, and what helped you engage them and include them in the work and leverage their expertise as well.
Andrea, you want to go first?
Anyone who wants to go first.
So I'll use the barbershop as a great example, right? And so when we're talking about working in our work, particularly around working with Black men, right? And recognizing the importance of the barber and the barbershop within their lives, we have connected with barbershops, and where we talk about, one, building a relationship, going there and doing blood pressure readings, one for on a health aspect, two, talking about the importance of breastfeeding, but also having this be men talking with men about it, right? That conversation. And then every once in a while, one of us ladies will go and provide some additional in-depth information, but also highlighting how we are a resource. And this came, in part by connecting with Calvin Williams out of Ohio, who is with the Talbert House, which really is centered around, working with fathers and empower, harnessing the power of fathers and their work. And they touch on a lot of different subjects and not necessarily breastfeeding. But after he had worked with us with some initiatives around breastfeeding, he himself went forward to get a CLC, a Certified Lactation Counselor certificate, so he can be more informed in serving the men that he worked with. But all this to say is that he had a tailgating kind of group. Well, we would call it like a support group, but he called it tailgating, right? And it's the essence of, doing things in the spaces that, men will want to do things in, and then adding in some of the additional health components, and so that's some of the ways that we've been able to work with some non-traditional partners. Like I said, recognizing the importance that they have in this work and, their strengths and how our strengths can combine together.
I'll give a little bit more of a tool on this. That list that I shared earlier, I can't remember if it's 18 determinants, 18 ingredients for good health in a community. But any topic that you have, if you were to go down that list and just say, what does this have to do with X? What does food justice have to do with school achievement or school to prison pipeline? What does civic participation have to do with that? What does reproductive justice have to do with that? Go in and ask yourself each of those things on the list. What does that have to do with my topic? And then ask yourself, and what groups in this area are doing that work? And then you're going to come up with a list of partners that may be coming from, you would never even would have thought of pulling them into the work that you're doing. And you'll people that are interested in active transportation, how can they help through to figure out who to get to the table. And then you do that process again once you have them all at the table so that they can buy in and they can identify how they can add value to what it is that you're trying to do. So that's a tool that and I totally agree with Andrea. And partners come from all places, and unless we put the invite out, unless people know what we're doing, that we'll never find them.
Well, thank you. I just want to share a couple of comments that have come in. This one's from Christine. She says, I love the concept of unsuspecting partners and a great job with the creative approach to engaging men. Says the barbershop is a brilliant idea, and that this is the creative work of community health that keeps her engaged, that keeps me engaged, is what she said. And I really want to just reiterate our gratitude for having you all share your knowledge and share your expertise and your experiences with the Now Learning community and the broader network. This is what this work is about. So I really appreciate that. We have actually come to the end of our time. And so I also want to thank all of our participants who joined us today. We will be sharing a link to this particular webinar, as well as a copy of the slides, as well as bios for each of our presenters today. If you want to learn more, you can find us at thenetworksofopportunity.org. You can find us on Gmail. You can also follow us on Twitter at NowWellChild and at Vital Village. So we hope to see you there. I think that is all for us today. We encourage you to join us in July when we have our next webinar, and we'll be hearing from Children's Health Watch. So with that in mind, thank you to Andrea and Javier for joining us today. We so appreciate you. Have a great rest of the day and a great weekend. Bye, everyone.
Bye. Thank you.
Thank you.